So welcome everybody to Spill the Coffee. I'm so excited that everybody's here this morning with us. It seems that this keeps on getting easier and actually more fun. I wanted to thank Wendy for always having our backs and always being there. She's an amazing speaker. She's an amazing friend. And like I said earlier, to mention to every on my upload yesterday, she actually blew my mind with the stuff that she's going to share with us today. So we're going to do a little bit of housekeeping right now. Just remember to keep things kind. Mute your mic when not speaking. Introduce yourself before speaking. Message organizer when you want to speak while this is going on. Hopefully we'll have a nice chat afterwards and share our thoughts. Keep it respectful and non-confrontational. Avoid profanity unless you really mean it.
Oh, darn it.
Please don't interrupt others. And please, closing is not optional. And the most important thing, remember to enjoy yourself. About Spill the Coffee, we created this as an online discussion venue to support industry through COVID-19 and establish relationships, cultivate collaboration, and facilitate strategic positioning. We're just going to go over some audio options. Click on the while, you have two options. Click on the wagon wheel and select computer or phone. If you select computer, wear a headset or earbuds. Select the microphone and speaker option. And if you select phone, select the country, dial the toll-free number, and enter the access code in the audio pin. There's also a chat option. Just click on the logo, read in the body, and type on the bottom, and select the recipient at the very bottom. And this is us. Welcome, Sleep Disorders Dentistry. This is our contact info, and you can visit our website, or you can take a screenshot of this if you want to contact us. And without further ado, here's Wendy. We'll give the controls to her now.
I'd like to thank Elaine and John for inviting me here and for being such good friends. But I'd also like to thank Linda Miller for giving me the opportunity to bring Paradise Dental Technologies to the #2 instrument company. We're worldwide now. And I also wanted to thank her personally for giving me the opportunity to grow and become the person I am today. As you know, my name is Wendy Birtles. I'm a registered dental hygienist since 1985. I'm currently practicing part-time as an RDH in Oakville right now. And I'm also the Canadian sales manager for PDT since 2001. So I've been working in schools, dental offices, attending trade shows, and giving lectures in many different countries. So my contact information is wendybirtles@gmail, and my phone number is also there as well if anyone would like to call me directly. Some of the objectives today, we need to be navigating through not only our time off, but the changes in the dental offices after COVID-19. None of us have a crystal ball, but how can we spring into action for the future? Dentistry is essential. Some of the topics I'm covering today are actually webinars in themselves. So I just want to have a little fun and get people thinking, and you can go on and delve into the areas that you want to with a little bit more backup support from the webinars that are online. Right now we're closed except for emergencies. I think we're all a little overwhelmed, right? And to say the least, we have many questions like, When are we going back? We have heard that Saskatchewan has some rules. The ADA has some guidelines that are being sent out, and New Brunswick, there's a few people starting to come out with the type of guidelines that we will need. Who's going back to work? When? Some of my friends don't want to go back, and some do. And what changes will we have to make? Right now, it's a time to come together, and not only just with your family, but your friends and all your colleagues. Before we get to changes, I wanted to talk a little bit about how do we stop these overwhelming feelings, because I've been having those as well. So I think right now you just have to stop and really get in touch with how you feel. Stop with the what ifs and wait for the what will be. And also just do something that brings you joy. Maybe something that you've done in the past that brings you joy, or find something new. And then prioritize your concerns. So what kind of concerns do you have? What pieces of the puzzle are you trying to put together? How do you manage your time and, all the things that go back when you go back to work? So communicate with your family and your friends and accountants and lawyers and the colleagues, the people that you work with. It's so important to stay connected during this time. We also need to get guidance from our regulatory bodies, and like the ADA, the ADHA, the RCDSO, the CDHO. There are so many different federal and local regulatory bodies that are sending out information. Adversity, sorry, 1 second. I just had a pop-up on my screen. Sorry, guys.
We don't see it on the send. By the way,
okay.
Wendy, it's interesting for you to know, if you have a pop-up on your screen, we don't see it on the send.
Oh, okay. So that's why I wanted to shut it. Adversity does not build character. It does reveal it, though. So I don't know how many of you have found out during this time. Some of your friends were more scared than you realized. Some of them were more broke than you realized. So we all have different things that we're revealing during this time, because it's not a time to build the character, but it's a time that you actually will show your true colors. The new norm, I don't like that term, only because I don't feel like dentistry was ever normal. I feel like it's a new reality for us. And so for me, I'm going to talk about our new reality. What is change? And why are we resistant to changes? Change is inevitable because, especially after COVID, we've already heard all the rumors of things, and we've seen changes in our grocery store. We've seen changes in any thing that was normal to us before, anything that was in our reality. So the only thing in life that is a constant is change, and we need to embrace it, and we need to be ready for the change and our new reality. Implementing changes may be daunting, but in the end, they're going to be really rewarding. And if we believe in the changes that we're making, it'll be really self-fulfilling as well. So I'd like to discuss some of the changes and how to prepare for them. We need to understand aerosols. That's going to be one of the really key things going back, overall infection control and PPE, but definitely understanding aerosols, because that seems to be the big buzzword. We need strategies to reduce bioaerosols. We need to be prepping our office now, and we need to be making our checklist. Some of the appointment changes we might see are pre-screening, letters to the patients, new welcoming procedures, having them wash their hands, use hand rub. We might need longer appointments. We might need spacing between our appointments. Our treatment planning will probably change. We may end up doing more longer appointments so that we don't see as many appointments in one day. For instance, sometimes we do quadrant scaling, and we may decide to do all of the scaling in one appointment as opposed to breaking it up into 4 different appointments. We'll need checklists for patients. We'll need employee checklists. We need to document everywhere. But now we have to go paperless as well, or we're recommended to go paperless so that we don't have charts and paper on the counter. We have to learn how to don and doff our PPEs because things are different now. We don't just put on our safety glasses and our mask and go to work. So there's a lot of uncertainty swirling around about, and anxiety for sure, about PPE and how to protect ourselves. Do we have to change our masks every 20 to 30 minutes if we have a long appointment when they become wet? Do we have to have fit? We do have to have fit testing. There's going to be all kinds of new things that dental people were not used to doing. And so we're going to have to do a lot of retraining ourselves as well. So when we're talking about aerosols or bioaerosols, or the contamination and the spread of viruses and all the other infections that can be spread, TB, pneumonia, we need to look at ways to reduce that. So most of the new guidelines that are coming out are recommending not using aerosols. And so that will be an interesting twist on things, because all of us in the dental office definitely depend on our aerosol producing equipment. So to go without it will be very different for us. But we'll adapt to the change, and when we're allowed to use them again, or we have the proper parameters to use them, then we will. So there's no 2020 vision for 2020, because it is what we cannot see that will hurt us. So the high velocity air evacuation is a must according to CDC for any aerosol producing procedure. We have testing that needs to be done on our units. Is each room the same? Is one better than another? So what happens in some offices is the machines in the back, and some rooms have a better suction than other rooms. We need to have the cleaning of the high volume evacuation units done properly. We need to make sure that the office is aware of how to do this and when to do it. We need to think about pre-procedural antimicrobial rinses because they're definitely recommended during this time, stronger than they ever have been. And we need to think about air purification systems, possibly external high volume evacuators. So there's a lot of things: cost per use, cost for training, time. When are we going to do all this? So this is some of the things that we can be thinking about now. Tips on reducing, and this is a keyword, not eliminating, because most of the suction units that are out there reduce aerosols, but they don't eliminate them totally. So ask yourself, do you suck at this? So we all love our saliva ejectors, and I think those will be key going forward to reduce the saliva pooling in the back. But we also need to make sure that anytime we're using aerosol producing equipment, that we need to have high volume evacuation. And so there's many things: Isolate, PureVac, Newbird, Hager. There's so many different types. This is a huge webinar in itself, just learning about all the different types of equipment that you could possibly purchase that would help you going forward. There's also external suction devices. So again, we have to look at the FDA approved. How much do they cost? How many do we need? How do we implement them? How do we explain all of this to the patients? And so there's going to be a lot of information going forward about the changes that we're making. And if they start seeing great big huge equipment like this in the room, I think they might just turn around and run and be scared. So we have to be prepared with the right answers for our patients based on what they're going to see when they come into the offices. Definitely we have to think about spitting. we have in place now, you are not able to spit and have the operator wash their hands in the same sink. So we used to have cuspidors, so we could have the funnels put on the high volume for them to spit in. That would be a solution. Possibly spitting back into the cup that you gave them water to rinse, or hydrogen peroxide as a pre-procedural rinse. So there's lots of things going forward that we need to think about how we're going to handle this, because we will not be able to use the air water syringe and suction if we're not allowed to use aerosols, because air water syringes do produce their own aerosols and a splash and a splatter. So what can we do when we go to our office? We can review all the infection control manuals, update, retrain all the staff. That's going to take a huge amount of time. So we should be looking at that now, doing that now. We should be checking our reception area and preparing for reopening. So, you know, what are we going to take away? What are we not going to take away? Sit in the chair in your operatory and look around. What do you see? Is the paint chipped? Is there stains? Is there dirt? Like, is there just clutter, anything? Because everything should be off the counter now. So, and then calculate some of the needs on your schedule for PPE, and how long do we have supplies for PPE? Do we have them for 2 weeks, 3 weeks? How can we prepare so that we are able, once we're to go to work, that we have the proper personal protection to accommodate all the appointments we're putting into the schedule? And it's just time to spring clean, basically. Like, we all did spring cleaning at home. Like, the first week, everyone's cleaning out their cupboards, their drawers. Some people were coming out of the closet. Cleaning their closet. And basically, we just need to open our cassettes and look for damaged or worn instruments. We need to assess whether they need to be sharpened. Like, I don't know how many people left dull instruments in the office when they closed down, but this is a great opportunity to go back in and grab your instruments if you can, or stay in the office with safe social distancing and be able to sharpen them. Evaluate the number of setups that you have. If you need more, this is a great time to add them. If you're not using cassettes, consider implementing them at this time because they're just faster and easier, and the patients will be looking, and we need to be able to present our instruments in a proper way. And make an order list and call your dental dealer and order all the things you need, and then make a second trip back to set up everything properly. Each practice should develop and maintain written infection control policies. So this is the part that's going to take a long time if you haven't done it already. And if you have done it already, you still have to incorporate all of the new guidelines. So you really need to turn to CDC and OSHA and OSAP and your regulatory federal and local bodies so that you can make sure that you have in place all the proper things that you need to have in place to go forward. In the reception area, you need to pretend you're a patient. And what do you see? Do you need to clean anything? Do you need to remove anything? Were there still magazines there? Were there things to touch when they were there? Are the chairs able to be cleaned properly? Do you need to repair anything? This is a great time if you have a rip in a chair to send it out for repair. Do you need to add anything? Do you have all the proper personal protective masks and gloves and Kleenex and things like that you'll need? And then look in your operatory, the same thing. I mean, if we're going to keep the paper charts out of the operatory, what are we going to do with consent forms and things like that? So we need to be thinking ahead. And then when it comes to opening up your drawers and actually doing an instrument inspection, you need to have a checklist now. So you need to look at your mirrors, your probes, your explorers, scalers, curettes, your surgical instruments, all of your restorative, and really look at them for things that could be missing or things that could be damaged or broken. So PDT, like I said, has given me the opportunity to learn so much about instruments and really what the difference is with PDT is that we turn to clinicians to find out what their needs are. We observe them, and then we create the blades and the ergonomic handles to make their life easier and make, them more effective and more efficient. So thank you, PDT. We do have a global sales team willing to help you at any time. So if you have any questions, you can go to our website and click on the global sales team and find the representative in your area. So now that you've actually opened the drawers and opened the cassette, you need to look at your probes. Do you have single-ended probes? You should maybe consider switching to our ACE probe, which is a double-ended probe, which gives you a better advanced comprehensive exam for periodontal charting, because our patients now are overdue and we will be having to rechart and reprobe everything, and we want to be as accurate as possible, especially in those areas with frications or deep pockets. We need to look at our mirror heads. We need to swap out old non-ergonomic mirror handles. What about the mirror faces? Are they scratched? Is this a good time to remove the scratched mirror heads and change them for brand new ones, so that when we go back, everything looks brand new and you can really see everything that you're doing? Look at your Explorers. Are your Explorers bent? Are they worn? Are they ergonomic? It's not as important for Explorers to be ergonomic, but you do need really good sharp Explorers and tactile sensitives. So without ultrasonics and piezo, scaling may feel like this, but now we have to match the instruments to the tasks that we're going to have to do. So we won't be able to rely on our ultrasonics to remove all of the heavy calculus. So we have to find instruments that will do that for us. So we may not have those ones in our kit right now. And so today I want to talk about maybe some choices. And again, this could be an entire webinar in itself. But I'd like to talk to you about the solutions that we have for you. We have rigid sickles, rigid universals, rigid Gracies. So instruments that you're familiar using, but buying them in a rigid form as opposed to a regular. So Montana Jack put us on the map and #1 selling dental hygiene instrument worldwide. It is available in a rigid, and some people don't realize that. And this may be an opportunity when you need some rigid Montana Jack to really get in there and get that calculus off. The shanks are thicker, the blades are heavier. You won't notice as much flex when you're really trying to pull. And it really will replace those heavy calculus patients that you were used to using your, let's say, your blue tips with for your Cavitron with something that's really rigid. We also have a Montana 4.5, which is a big brother to the 204S, and it has a longer, more rigid terminal shank. So again, most likely a lot of people haven't tried this, but it's a really great instrument if you have heavy sub in between the posterior teeth. So again, just another opportunity to look at your instruments and see, do I have the ones, or am I working with instruments that don't have good blades, that they're already worn out? Dr. Gracie invented Gracies in 1940, and PDT has changed the blade design slightly, kept the same angulation, same adaptation. We just have made the blades shorter and more curved, so you get better adaptation to the tooth and to the root surface. And so during a time when we don't have a Cavitron or ultrasonic piezo, anything to use to help us remove that heavier deposit, we want to be able to get in there and be effective and also be efficient. So we need better blade adaptation, and PDT has definitely helped that, less tissue trauma for the patient They're going to be already traumatized from all of this. So we want to try and keep the appointments as comfortable as possible for the patient. We do have lots of different Gracies, and it gets very confusing sometimes when you're looking at choosing the right Gracie for the task. So I'm going to hopefully help you by making this a little bit more simple. So we have rigids, we have extended reach minis, we have extended reach mini rigids, we have extended reaches, extended reach rigids, extended reach micro minis, and even in titanium. So you can see from the photos below that if you have a regular Gracie and you're trying to get into a deep pocket, you probably won't be able to do that very effectively. So you really need to look at whether you have your minis around, because a lot of us were using ultrasonics to get into these areas. And if we can't use the ultrasonic, then we do need a blade that will adapt and be comfortable for the patient. And then we also even have a micro mini. So at the very deepest part of the pocket, you may find that you need that type of instrument. Just to explain the difference between a rigid and a regular Gracie, the rigids have a larger diameter. They're stiffer, there's less flex, and there's definitely better for tenacious calculus. So these are available in extended reach and extended reach minis. So again, you have to figure out which one will help you do the job that you need to do, and understand the difference between ordering them, whether you want a regular or a mini, and whether you want a regular or a rigid. The extended reach minis, the shanks are 5 millimeters shorter, and they have half the blade length. And so this really is helpful, like I said, to get right into those areas. And the extended reach mini rigids have the same longer terminal shank, half the blade length, but they have the rigid blade. So again, less flex and better and faster, easier removal of tenacious calculus. And of course, we do have the extended reach micro minis as well. So like I said, that blade is half the length of a mini and 20% thinner. So it is going to get right down into the bases of those pockets and help you remove those deposits. We also have the Queen of Hearts, which is for deeper perio pocket access as well. It helps to replace those ultra fine ultrasonic tips that we were using. So when they came out with ultra fine ultrasonic tips, it was amazing because we were able to get these nice fine tips down into these root surfaces where you have frications, line angles that are difficult to manage, irregular root surfaces, depression, and all sorts of root anatomy that you just can't get with a regular blade on any scaler or curette. So you really need to look at getting some instruments in your repertoire that will help you get into these areas now if you were relying on something else to do it. We also have the O'Hare Millennial Curettes, and those are awesome. They're little spoons that help you go into these areas, and they're very tiny, but they will help get that last little bit of residual calculus that you couldn't get with anything else. So again, if you need more information on any of these types of instruments, you can go to YouTube, you can go to the PDT dental website, see videos, you can call us, you can reach out to your representative to help you with more information on these types of instruments. And really, like, once we find out what you're using, we can recommend what you might need to supplement what you're currently using to be the most efficient and effective going forward. So over the years, I've worked with many of you at trade shows, and I think there's a lot of questions about how do I make these changes in my practice, because especially now everyone's going to say, oh, they're not going to buy me instruments. Like we haven't been open. We don't have this. So again, we can help you as representatives of PDT to help you find solutions based on what your challenges are in your dental office. So everyone has different challenges, but if you could even just buy one new set of instruments and take pictures of those instruments with your intraoral camera, hold up your old Montana jack with your new one and take a picture and show the doctor and say, this is why I need a new one. And show your old Gracies versus a new Gracie, or maybe just understanding that without ultrasonics, you do need more hand instruments. We can take advantage of special offers right now because we have created specials to reduce your cost if you're buying in bulk. So definitely check out our specials on our website for this time, and really take advantage. Buy as many as you can to get the best possible price at the end. We also have a recycling program. If you turn in 12 old instruments, any brand, you get one free. You might consider buying your own. I know that a lot of you are probably saying, I'm not buying my own instruments, but we do have a lot of hygienists that will buy their own instruments, and so I encourage you to consider that as an option. You could implement one tray setup at a time. Ideally, you should have enough setup to last your entire day. So if you're seeing 7 patients, you'd need 7 trays. 8 patients, 8 trays. If you're only going to see 4 patients, then you need 4 really good setups. And then also you need to understand who is your clientele. What type of patients are you seeing? Are they all perio? Or do you have some pedo patients in there? Or do you have just regular recare patients that you might not need as many instruments for? So try to get a cross-section of what type of instruments you'll need based on the types of patients you see throughout the day. So if you see 3 perio patients and 4 regular checkups, you might not need 7 perio trays. And so just try to understand what type of patient load you have and what type of patient you're seeing. And be the change agent in your office. So, you know, we're not going to have ultrasonics. So we need to have more instruments that will be more effective than we maybe needed before. And maybe some of these hand instruments will actually make the patients feel more comfortable. Maybe they're going to be happier now because you're not using the ultrasonic as much and creating that root sensitivity or, you know, the water. So one of the things that I've noticed for sure when I'm using water is the patients feel like they're drowning. And so they'll, you know, often start choking or gagging, and that may lead to coughing, which you don't want to do at this time either. So again, just being very cognizant of the times and the changes that we're seeing with our patients makes me, you know, really want to go back to more hand scaling right now for sure, and making sure that I have the right equipment to do that. I don't think that you should be asked to do your job without the right equipment, because that just wouldn't be fair. While you're in the office, check your restorative, check your surgical. Many of us have corroded instruments or they've rusted for some reason. You know, PDT has great new restorative instruments that are new designs, more ergonomic for you. Definitely in our office, when we switched out the composite placements, the dentist there thought it was more like working with an artist's brush as opposed to, you know, working with the old metal handled instruments. And, you know, we have things like an adjustable scalpel handle that has 7 positions. So again, look at what your restorative and your surgical instruments look like. How are you processing them? Do you need to have them in cassettes now? Are we going to try to reduce the wraps we're using or the bags we're using and try to condense everything into one cassette that has 1 wrap, as opposed to opening 7 bags with 7 different instruments in them? So again, we're looking at being environmentally friendly going forward, and opening something in front of a patient that will make them feel really safe and secure that they're in your office. And the presentation really helps to send that home. And if you're not doing it now, then this is a great opportunity to spend the time that's needed to pick the right cassette, to customize it to your liking, and make sure that you have what you need in your office. So some tray setups used to look like this, and now, of course, my tray setup looks like this. Over the years, we've all practiced in many different ways. I think when I first graduated from dental hygiene, the instruments were in a ceramic dish in the drawer, and they were not processed in bags. We did use an ultrasonic. They were loose in the ultrasonic, and then we, put them into a sterilizer and then put them out on a tray, a paper tray, that cover that wasn't sterile. So it's very interesting to see in just the time that I've been a dental hygienist, the changes that have already happened with instrumentation and how we present them and what's expected of us. So like I said, we do have great cassettes. There's 5 different sizes. You can customize them in the way that you want. They have lift-out racks. They have a flip-top opening, which means it's a single latch, and then you just flip the top underneath. I know John and Elaine have these in their sleep disorders clinic, and they just are so easy to use, and we are more than willing to help you customize them so that they're perfect for you. This is a life investment, so we want to make sure that you're not spending money where you don't need to. So again, this is a whole, webinar in itself, how to pick a cassette and how to customize it and do all that, but we're more than willing to help you during this time. So if you have any questions about cassettes, please feel free to reach out to us. Sharpening. So in the time that you're spending in your office right now, because I have heard over the years from every hygienist, when I've gone into offices, when I've been at trade shows, and the number one reason why people don't sharpen is because they don't feel like they have time. So we have lots of time right now, and we have time to really evaluate our instruments, and we have time to sharpen them properly. So if you're happy with the way you're sharpening and you don't need any help with your technique, that's great. That's a good percentage of hygienists can do that. If, however, you don't like sharpening and you want something that's easier and more accurate to sharpen your instruments, then definitely reach out to us or go to YouTube or our website and check out the videos on how to use a PDT Gleason guide, because for those of you who like bagels and tried to cut them over the years and really were hacking at them when they came out with bagel slicers, this reminds me of that, because it's just so easy to use and every time it's perfect. So again, this is a webinar in itself, so we're not going to spend too much time on how to sharpen or when to sharpen or techniques to sharpen, but definitely I'm more than willing to help you with this. So please reach out to me and I'll help you with your sharpening needs during this time. If you live in the U.S., you are able to send your instruments into PDT for sharpening. In Canada, we don't have that yet, but we do have this Gleason guide, which I think is still the best possible way to sharpen, because you don't have to send them in. You don't have to be without instruments. You can sharpen them very quickly and very easily and maintain them on a regular basis if you have the guide right in your office. As I mentioned, there's recycling programs. So ours is called Earth Care, and we have 12 recycled gets 1 new instrument. So that's any brand, any condition. There's forms and information on our website. All you have to do is type in PDT Earth Care and you'll get some information on how to do that and what types of things that we can help you with, and maybe make some choices of instruments that you've never tried during this time and using this program so that you're not spending money and you're actually getting some of those ones or a sample of one that you want to try. So let's say you want to try the Montana Jack Rigid, or you want to try a Barnhard Rigid, or you want to try one of the Gracie Rigids. This is a great opportunity to turn in some older instruments and get one of those in your hand and see the difference it makes for you. And then you can take advantage of the specials and order more once you figure out which ones you want to try. We were really considered non-essential, I guess, because we were closed during this time. But I want to reiterate that we have oral systemic links. There's oral cancer. We are stopping the spread of COVID, so I do feel really good about that. But what I would rather do here is just reinforce not only to each one of us, but to each of our patients, our friends, our family, and ask them, would you rather have a filling or a root canal or an extraction? Because if you've had both, the difference between having a filling and a root canal would be 3 months, and it could be up to $3,000. So again, we don't want to increase cost of dentistry. We still want to stay on the preventive side of things. We still want to be, proactive rather than reactive. Hygiene appointments were halted. And so the difference between some of our hygiene clients and patients now is that the gingivitis, which is reversible, may have turned into periodontitis, which invades that surrounding periodontium. And that could cost hundreds of dollars more to try to treat that, because you're no longer just providing a preventive service, you're doing a treatment. So again, we need to educate our patients. We need to make them believe that what they're doing with us is very important. And so their cleanings are important. And definitely a periodontal therapy appointment is much different than just a routine 6-month check to find, a small cavity. If you think we're not important, then definitely finding an oral cancer lesion in a routine checkup at 3 months can save a life. During this time, we're definitely going to see an increase in alcohol consumption, according to the news, vaping, smoking cigarettes, and even marijuana now, a rise in HPV virus. So all of these things are going to lead to a possibility of increased oral cancer. So again, very important that they come in for their checkups. And John, you can attest to this, that treating a sleep disorder can be life-saving, as well as a huge cost savings to our healthcare system going forward. So again, all of these procedures that we do are really important, and we can't work from home. We can't diagnose dental disease. We need to have the patient in the chair. We need to look inside their mouth and see what we can find. And there's so many changes in adaptation. I feel like we're losing that whole thought process that we are there to help patients stay in a preventive environment rather than a treatment-orientated environment. There's lots of links, obviously, to your body and oral systemic links, and I don't need to go through all of these right now, but maybe for the patients, they need to understand that, again, they're not just coming in for a cleaning, that we're helping their overall health, and that not waiting till you're in pain is actually the best possible treatment that you can have, because if you've lost anyone from any of these systemic diseases, if we could have helped them by cleaning their teeth or fixing that cavity or giving them a crown or a bridge to chew better with, that's really important for us. There's some positive sides to COVID as well. We've all had time to rest our wrists, our back, our neck, our legs. We can all look at when we go back that we should have all these things in check, and we're able to, exercise every day because now we have time for that.
Sorry.
Well, when you're not doing the hundreds of webinars. So again, it's checking your own ergonomics, because when we go back, we're going to be extremely stressed, I believe, and we're going to have a lot of stressed patients. The days aren't going to be easy. So really take this time to make sure that you take care of your own body, because if you don't put your own oxygen mask on first, then you can't help others. And so I think it's really important for us to have our own oxygen masks on when we head back into the office. And literally, I mean oxygen masks. We may actually need tanks to breathe. I think we're all in the same COVID storm. But one thing I'll tell you is that we're all in different boats. And so if I've learned anything from this, is some people are thrilled they don't have to go to work. Some people are excited they've had a chance to catch up on CE. Some people don't want anything to do with anything. Some people are just scared. Some people have newborns. Some people have new puppies. And so we're all in different boats right now, and we all have different frames of mind facing this pandemic. And what I will tell you is that when we go back, all of our patients are in different boats too. So we won't be able to treat them all the same. We will have to figure out what boat they're in and what was their boat ride like for the last 2 months. You know, we need to be able to help them transition into the new reality post-COVID. So I think that if you have a better understanding of yourself and the people around you right now and what kind of boat you're in, that'll help you when you get back with your clients and your patients to really understand them and understand how you can help them best. We are the superheroes. I do believe we save lives. We save money, definitely, by doing preventive care rather than treatment. We save embarrassment. We boost self-confidence. And overall, we are basically an essential service for people's well-being. And people need to be reminded of that. And I think that we already will have a healthcare that's struggling. So we don't want to be sending our patients through the regular healthcare system, which will already have longer waits. So really important to keep them healthy and help them maintain their oral health at home, in the office, and help them spread the word to their family and their friends so that that message is getting out to everyone as quickly as possible. Like I said, there's lots of ways to connect. We found out that we can do a GoToMeeting. I've done Zoom meetings. We've had, I heard that they've had a virtual graduation ceremony in Japan where they had robots with pictures of the graduates' faces on them, and they actually did like a mock graduation. Really cool things. We had a birthday party with my family on a Zoom meeting. I think there's all kinds of new ways to connect online. So we've all been learning, and we've learned about the challenges like we did today when I couldn't get going. I'm not sure what happened there. And so thank you for your patience on that one. And connect on social media. Connect with your PDT sales representative. Connect with CDC, OSHA, OSAP, regulatory bodies, national dental associations. There's so many people that you can connect with right now that if you're struggling with any one area, you can reach out for help through websites, through phone calls, and we may not be able to see each other in person, but we can definitely connect. So please connect with me if you have any questions about PDT or products. And I wanted to thank John and Elaine again, please, so much for what you've done here and for being who you are and making the world a better place.
Yay!
Thank you, Wendy. Wow, that was that was incredible. Thank you. I thank you so much for always bringing to light so many, your wisdom and so much information that you have is incredible. And for bringing us all together. I can see everybody.
Does anybody have any
Yes, John?
questions for Wendy about what was discussed today?
Questions, no, but can I make some? I'm in an economically depressed area, and I have to be creative. I think I've shared with Linda and Wendy already some of my ideas, and I was down in my office today, and I personally don't ever want to give up my ultrasounds, for my cleanings and what all. In my office, first of all, I use ozonated water, so that's already a disinfectant inside my chair, and it goes through my turbine and my ultrasound. This morning, I was thinking, what can I do to suck up some of those, vaporizations? And so this is a 5-liter bottle that I have cut. I know it's a little hard to see, but if you can see, I have a high-speed, real industrial type of suction device. It's a laboratory one, and I use it because I use sandblasting in my office. And so this fits wonderfully. I don't have anything, all the stores in Spain are closed, so I put rubber bands around here, and it fits perfectly onto this high-speed suction unit. And if I do this, I'll have the patient hold this, and they'll be sucking up, and I'll be able to use my ultrasound. Plus, I still have my saliva ejector and my high-speed suction. So, I mean, this was, well, I don't know what it costs in your country, but for 2 5-liter bottles, it's about $2. So I threw the water out, and I kept the bottles. How's that for recycling? But anyway, I could buy several of these, and I can disinfect these, or I can throw them away, however I'd like. But again, it's an option. I was looking at high-speed suction unit for the dental chair. They were 3,000 euros. So you're looking at $3,500.
The cost is definitely going to be prohibitive, and then the number of units that we'll need per office will be increase that. That's just for one operatory.
Yes, and so I would recommend, again, personally, I've been using ozone for a while. I love it, and plus all, of course, PDT's instruments. But the ultrasound, I find, is something that I really need. And as a dentist, I can't be burning teeth. So I think this is, it could be a wonderful option, and you don't have to spend the mega bucks. I mean, we have to take care of ourselves, and we can talk with Linda and with Wendy about some of my PPE options. An option, very inexpensive. For one, I guess for you guys, it'd be like about $1.50 for a PPE. And so that's a big option, and you don't mind ripping that thing off, and you don't have to even pass the cost on to the patient. We have to think of cost also, because here for a PPE, you're talking about 20 euros. That's about $25 plus. For me, my assistant, that's $50 per patient, and you have to rip it off after each patient, so, and throw it away. Where I'm spending maybe $3. That's a big difference in price. But again, love the instruments. I've been a long time user. Absolutely love them. And in Spain, they say that I'm a scaling wench. Yay to the scaling wenches! I'm very proud of that. So, area is very important. And then as far as the sleeping, John, I was just on just before this. They were talking about children and the problems with sleeping disorders, and what dentists can do in general with rapid expansion, looking at the adenoids, the tonsils, and how we can develop, just make life changes for children. I know I saved my son at 5.5. He was snoring like a train, locomotive going through the house. I put a rapid expander on him. He is now a physician, bright, and he can avoid a lot of problems, because we're talking about, kids that become hyperactive because they can't breathe. And, it's all the facial dysfunction. We can do so much. Our jobs are so important. each one of us here, there's no one here that cannot do something, because as a hygienist, you can do facial, myofacial help, plus the dentist, you can help diagnose this, and the dentist, we can go ahead and put the proper apparatuses. Of course, we have to talk with ENT people, and we can do life-changing things for people when they're really little, and it's so much harder to do it when they're older. We know that if you're gonna straighten out a tree, do it when it's young. That's all for me.
Thank you.
Elaine?
Anybody else with a question or a comment? We're,
Well, I noticed that Linda is here, so I would like to introduce her. Linda Miller is the owner, CEO of PDT, and she is on our screen. So maybe you could just say hello to everyone.
Hello, all. Thank you for attending today. Wendy, thank you for such a great presentation. And Elaine and John, it's great to meet you.
It's great to meet you. Finally, I have you as my connection on LinkedIn.
Yes.
Thank you for liking my post, Linda. I really appreciate it.
You're welcome. This is amazing what you're doing. This is fabulous.
Thank you.
And the whole idea was to keep it nice and light and not make it too heavy. And like I mentioned, all of these things that I was talking about are complete webinars or studies in themselves. So just a quick overview, and then people can go on and investigate further and more in depth into what applies to them.
And our focus with PDT is just serving you. Anything that we can do to serve the dental profession, we're here for you. And our focus is keeping you healthy and comfortable, as well as more comfort for the patients. So thank you.
Thank you. Thank you, Linda.
And we must never forget that we should sell dentistry with sex, because it's not just having pretty teeth. It's if you have a sweet mouth that someone's going to receive that kiss. It's so important, and that really touches strongly with all of us. I think we all like to get kissed. It doesn't matter. I'm 63 and I still like being kissed. So, and may not have been the most beautiful or the thinnest person around, but hey, the girls used to say that my kisses were sweet. So, if we buy everything else on television, cars, perfumes, clothes, everything with sex, let's make dentistry sexy. Okay?
Okay.
That's why we have Elaine.
There you go, Linda. We're keeping everyone sexy.
Okay.
Laurie Anderson actually had something, she shared something with us in the chat, and she was saying that perhaps someone can 3D print the bottle to adapt to a high volume evacuator. That could be an idea. I know that Pantera Dental has been 3D printing the shield. They started because they were not, doing any of the DSATs, or like they stopped production. So they start 3D printing, and they actually had a link where if you had a 3D printer in the world, you can actually go and click on the software and download it for free and help. So that could be, that's a great suggestion. Or anybody else?
To add to your 3D, my technician here in Spain, he was asked by the fire department to make some adapters for some of these snorkeling masks that have the little tube on the top. I don't know, and they adapt it so they could put a filter on it, because since there were no masks or anything available, Spain has had over 35,000 medical professionals infected. So this is something definitely to consider. We are high at risk, and so we should definitely take this seriously. But we got to add a little sex to it, so we don't scare our patients off.
Lucette has left. She has to go to another webinar. So thank you, Lucette, for joining us. I think she's gone. And I just wanted to let everybody know that our next presenter for next week is here, Sula. She's right in the middle of my screen. And I don't know if you want to give us a little bit of an advance of a flavor, a taste of what you're going to be talking next week. I know the title is It's Time to Pivot, Not Panic. So, okay, thanks, Elaine. Hi, I'm Sula. And basically what I do is I'm a dental consultant, coach. I walk into dental offices, which I'm missing that part. So I'm really trying to myself, I'm pivoting my business and actually going on Zoom calls and other webinars where I could actually, because I do my best job when I walk in, and it's all about energy and shifts and getting to know the team and the dentist. However, now because I can't walk in, I'm trying to do it through webinars, and it's like just kind of asking the right questions, allowing them to answer. And my webinar or my week will basically just be on trying to advise and educate the dentist or practice owner to maybe shift their mindset and start thinking forward and what's next, and to get organized and ready to open up. So a lot of what Wendy said today is amazing, because it is a little bit of like, I'll touch on a couple of the things that she spoke about as well. But again, I'm coming in from a consultant and patient kind of mindset. So I think, Wendy, you mentioned walking into your practice and being the patient and seeing what the patient sees. So yeah, so that's basically what my presentation will be like. And again, just opening up the practice owner and the dentist's mind to things that really it's not in their craft to look around. They know they're great in their op and the treatments they do, right? So consultants and coaches help the team and the dentist come together. That's it. So hopefully everybody could join us next week. It's on the 6th, right? Yeah.
Thanks for coming, everyone.
Thank you. Thank you so much for coming, everyone. We'll see you next week.
Don't spill your coffee on your computer.